Welcome to 12 to Your Health. I'm Dr. Derek De Silva. It's the leading cause of death here in the U.S. We're talking about stroke. It can affect people of all ages and races. Joining us with what you need to know is Dr. Panezai. She's a neurologist at JFK Medical Center in Edison. Thank you very much for joining us.
Thank you.
So what's a stroke?
So a stroke is a sudden disruption of blood flow to the brain, and it can happen in two main ways. The most common type of stroke are what we call ischemic strokes, and this is the type of stroke that happens when a particle, a blood clot, blocks blood flow through a blood vessel. And so the brain tissue is deprived of oxygen and nutrients it needs to function adequately.
Right.
The other type of stroke is what we call a hemorrhagic stroke, and that happens when a blood vessel ruptures and blood seeps into the brain tissue nearby. And in that way, blood flow is disrupted to the brain as well.
Warning signs, what typically do we need to look for?
Well, there are numerous warning signs of a stroke, and it really depends on which part of the brain is affected. But the key thing to the warning signs are that it's of sudden onset. So sudden onset weakness or numbness on one side of the body, sudden onset of difficulty speaking or understanding, sudden behavior change, sudden difficulty walking or having difficulty with balance,
Right.
sudden vision loss, or a severe headache of unknown cause. All of these can be stroke warning signs.
What about risk factors? Typically blood pressure, right?
Yes, absolutely.
High blood pressure?
There are, different categories of risk factors. There are ones that are non-modifiable, so you can't really change them, and then there are ones that are modifiable. So the important ones to focus on are the modifiable ones.
Sure.
So these include things like high blood pressure, smoking, obesity, diabetes, things like that,
Right.
high cholesterol.
And I think where you go, how quickly you get there is really the issue when we talk about stroke and heart disease. Can you just address that very quickly?
Absolutely, yes. Time is of essence, and we often say with stroke, time is brain. So that's why it's so important to recognize the symptoms of a stroke and to call 911 immediately so that you can present to the emergency room as soon as possible. Now, there are different types of hospitals for stroke. There are primary stroke centers, which basically they can evaluate stroke patients and give them clot-busting medication to try to treat a stroke. And there are comprehensive stroke centers, which offer more comprehensive care for complex
And
stroke patients.
is that where JFK is involved in the more
Yes.
comprehensive approach to this whole thing?
We are a state-designated comprehensive stroke center and a Joint Commission certified comprehensive stroke center.
Dr. Panezai, thank you very much for joining us.
Thank you very much.
Thank you.